A man walks out of the Hilton Midtown, slim navy suit, briefcase, no security. He's heading to an investor meeting. He never makes it. 3 rounds back, right calf, right thigh. Brian Thompson, CEO of America's largest health insurance company, dies on a New York sidewalk. He was 50 years old, a husband, a father of 2. The shooter doesn't run, he walks, he boards an e-bike, he disappears into Central Park, and on 3 brass casings left at the scene, police would later find 3 words engraved by hand: deny, defend, depose. This is the story of how a $500 billion company became the most hated brand in America, and how 1 bullet and 3 words exposed an empire built on the business of saying no. For 5 days, America didn't know his name. Then on December 9th, 2024, at a McDonald's in Altoona, Pennsylvania, a customer recognized a face from the news. Police arrived within minutes. The suspect handed them a fake ID. Mark Rosario. According to investigators, he was carrying a 3D printed pistol, a homemade silencer, a false driver's license, and a 3-page document, what prosecutors have described as a manifesto. His real name, Luigi Mangione, 26 years old, Ivy League graduate, University of Pennsylvania, computer science, cum laude, class valedictorian at one of Maryland's most exclusive private schools. His family, according to public records, is worth tens of millions of dollars. He had no criminal record, no political affiliations, no connection to any watch list. By every external measure of the American system, he was a winner, which made what happened next harder for the country to process. Because within hours of his arrest, the country's reaction to the killing became the bigger story. It wasn't condemnation. Across TikTok, Reddit, Instagram, millions of Americans began saying things that no public figure had ever heard said about their assassin. Songs went viral, fan accounts appeared overnight. A legal defense fund crossed $1.5 million in donations. A Harvard Caps Harris poll released in early 2025 found 41% of Americans under 30 said the killing was, quote, acceptable. A separate Emerson poll found similar numbers across age groups. These were not numbers any insurance company had ever seen attached to the death of its CEO. So investigators asked the question every detective starts with. Why? According to court documents, the document found on Mangione targeted one specific industry. Not banks, not tech, not government, health insurance. It referenced a company that, according to the filing, had, quote, had it coming. A company that, according to public federal lawsuits and Senate investigations, had built one of the most profitable empires in American history, UnitedHealthcare. Mangione has pleaded not guilty to every charge. His trial begins September 8th, 2026, but the conversation he ignited, that was already burning. Investigators began reconstructing Mangione's recent history. In July 2023, he underwent spinal surgery for chronic back pain. Around the same period, his grandmother, according to friends interviewed by reporters, entered long-term care. In 2024, his friends say he disappeared from social media. He stopped responding to messages. He stopped going home. Then on November 30th, 2024, just 5 days before the shooting, prosecutors say he checked into a New York hostel using a fake New Jersey ID. He waited. December 4th was Investor Day at the Hilton Midtown, a public event on the company's published schedule with the CEO listed as keynote speaker. What the public didn't know yet, and what would soon become the story behind the story, right, was that Brian Thompson wasn't just any CEO. He ran the company that more than any other in America had become the public symbol of one single word: denial. United Health Group did not start as a giant. In 1974, it began as a small company in Minneapolis called Charter Med. It managed insurance plans for a single hospital group. By 1984, it went public on Wall Street. By the 1990s, it had absorbed dozens of regional insurers. By the 2000s, it had stopped being just an insurance company and started becoming an entire healthcare system unto itself. Through its subsidiary Optum, according to public corporate filings, it now owns or operates pharmacy benefit managers, physician practices, surgery centers, data analytics firms, health technology platforms, and mental health networks. According to industry analyses, United Health Group today touches, directly or through Optum, roughly 1 in 10 doctors in the United States. Revenue in 2024, over $400 billion. Market value at peak, $560 billion. Brian Thompson's compensation in his last full year, approximately $10.2 million. By every Wall Street metric, the empire looked unstoppable. But empires don't just collect revenue, they collect enemies. And UnitedHealthcare had been quietly collecting them for years. In 2023, an investigation by Stat News revealed something the public had never been told. UnitedHealthcare had been using an artificial intelligence tool called NH Predict. According to multiple federal lawsuits and a U.S. Senate investigation, the algorithm was used to determine when elderly patients should be cut off from rehabilitation care after hospital stays. According to court filings, the system allegedly had a 90% error rate. That figure is contested. United Health has denied wrongdoing. The litigation is ongoing, but the U.S. Senate's Permanent Subcommittee on Investigations, chaired by Senator Richard Blumenthal, published a 54-page report in October 2024. The numbers stunned Capitol Hill. Between 2020 and 2022, denials for post-acute care at UnitedHealthcare reportedly rose from 10.9% to 22.7%. In some categories, more than double. Critics called it a denial machine. The company called it cost containment. The patients in the middle, they had stories. And finally, those stories had names. Gene Locken, 91 years old, Minnesota, according to a federal class action lawsuit filed in 2023. After a fall, fractured his leg. His doctors said he needed extended rehabilitation. The lawsuit alleges UnitedHealthcare's algorithm cut his coverage off. His family paid out of pocket, reportedly $14,000 a month, to keep him in care. He died on July 17, 2023. Dale Tetzloff, a retired pastor from Wisconsin, a stroke survivor. According to the same federal lawsuit, his rehab coverage was terminated by the same system. He died less than a year later. These are not isolated cases. They are named plaintiffs in active federal litigation. Their stories are public court record. Their families are still seeking accountability. United Health has denied the lawsuit's claims and is defending itself in court. But for millions of Americans watching from home, the question was no longer about one shooting in Manhattan. It was a question their grandparents had been asking for years. Why does an algorithm get to decide who lives? Here's the part of the story nobody is talking about. The Mangione family of Maryland are not just wealthy. They are healthcare operators. Public corporate records show the family owns and operates a company called Lorien Health Services, a chain of long-term care facilities with at least 9 locations across Maryland. Nursing homes, rehabilitation centers, assisted living, the exact same industry on the exact same side of the bed where UnitedHealthcare's algorithm was allegedly cutting off elderly patients. 2 healthcare empires on opposite sides of the same battlefield. One, a $500 billion machine that decides who gets care. The other, a family of facilities that depends on those decisions to fill their beds and stay open. This is not speculation. These are public records. Investigators have not publicly stated that the family business influenced the accused's actions. He has pleaded not guilty to every charge, but the symbolism, and for anyone willing to see it, it was thunderous. The accused, the victim's company, same industry. The trial begins September 8th, 2026 in New York State Supreme Court. A federal trial is expected to follow. Luigi Mangione faces multiple charges, including murder and acts of terrorism. He has pleaded not guilty to every count. UnitedHealthcare, its stock is down approximately 32% from its peak. The CEO position has been refilled. The lawsuits over NH-Predict are still active. Executive security spending across the entire industry has reportedly surged. But the empire itself, still standing, still profitable, still, by every legal measure, the largest health insurer in the United States, because empires are rarely destroyed by one event. They are weakened by the moment everyone finally pays attention. A bullet didn't create the conversation. The bullet just made the country stop scrolling. For a brief moment in December 2024, 46 million Americans on Medicare, 160 million Americans with private insurance, and millions more without any, all looked at the same company and asked the same question: who exactly is this empire serving? The answer they decided is what made Brian Thompson, a husband, a father, an executive, the most mourned man in corporate America, and what made the man accused of killing him into something this country has not seen in decades. A folk symbol of a system nobody believes in anymore.